We're back live with you tonight here on In Focus. As the country battles higher stages of load shedding, the South African Medical Association says only 77 of the 400 hospitals and clinics in the country are currently exempt from power cuts. The association says this, of course, negatively impacts on operations of our health facilities and compromises patients' health. It also is calling on the National Department of Health to stop dragging its feet in engaging Eskom and other power utilities on this matter. The South African Medical Association chairperson, Dr Mvuyisi Mzukwa, joins us now to explain their request. Dr Mzukwa, good evening, and good to have you once again tonight here on In Focus. So last week Thursday, we hear the Health Minister, Dr Joe Phaahla, saying the funds, the budgets of the department themselves have been exhausted as far as the question for alternative power sources. In fact, they are saying they are concerned as well about the ongoing blackouts because they were beginning to impact on the department's ability to provide services. Yet, at this particular point, we only have 77 of the 400 hospitals and clinics in the country that have been exempt. Why? Why is there such a dragging of feet when it comes to this matter?
Good evening to you, Thabo, and to your viewers, and thanks for having us on the program. Thabo, it's disappointing, to say the least, that the Minister of Health can just simply go out to the public and pretend that he's concerned that we are facing what we are facing in the healthcare sector. I mean, to say you are concerned without a plan is an empty word. I don't believe that in South Africa we can have a minister who can just go out there and brief the public on nothing, because that was a nothing briefing. To be telling people that you are concerned, but you have never approached the minister of the SOEs. You have never approached the municipalities. You have no plan in place, but you're telling the public you are concerned. It's a very empty word, to the public. It does not mean, as a person who's concerned, I would come out and say, I've already approached the Minister of SOEs and I've already approached the Treasury. The Minister has not even approached the Treasury for that matter, but he goes out to the public to lament. What are we supposed to do? A minister cannot just go up and throw his hands in the air as if he has no colleagues in the cabinet. He should be telling the public, these are the steps that government is taking. That concern to us is just empty.
Yeah. I mean, if the president comes out and says it's a process, that the energy plan won't happen overnight, I would think it's a message that has also been spread to his cabinet, to the various ministers, to say we are in this for the long haul, so to speak. So the suggestion there would be that every department must come up with some kind of a long-term plan as to how we're going to mitigate and intervene in these circumstances.
I fully agree with you. I mean, at this point in time, load shedding that did not start yesterday. We've had this conversation long before. This higher stages of load shedding. But we would expect that at this point in time that, the department has plans in place, alternative arrangements, making sure that the lives of people are not going to be affected. It's a pity that we are not going to know how many people have lost their lives due to load shedding. It will remain a secret because people would avoid so many other things. But it is important for us as a medical association to say that we don't even want to have people who are dying from the impact of load shedding. We want to prevent that. Hence, we are saying to the minister, please don't come out in the media and tell people your nothingness. You don't have a plan. Don't go to the media and say things that are going to upset the public. Yeah. If you have something, if a plan, tell us the plan. The plan must be to save the lives. It must be a plan to say, I've spoken to the Treasury, we've agreed on the money that must come out so that we can, increase our budget for diesel, for oils, for everything that we need. But to just come out and say, I have not spoken. In fact, you even address the municipalities and say to the municipalities, please think about the hospitals when you have load shedding.
Yeah.
You have not, as the minister, intervened. We're calling upon the intervention of the minister. Yeah. That's what we call it.
Do you think the minister is looking, I suppose, for a cop-out here? Because, in a sense, he's pushing the responsibility of load shedding to Treasury because he's making this particular issue in terms of his address about money. So what we are likely to hear is that, well, we have not been able to come up with alternative power sources because of money.
I don't think they should be taking that line because they are on record saying that they are going to push ahead with NHI regardless. I mean, if you can't even put diesel in a generator, do you want the public to believe that you can deliver on NHI? So I think they need to revisit their statements and even advise the minister not to go out with such empty promises. So this thing of saying pushing passing the buck, to Treasury, it's really disappointing because at this time I don't think there's any engagement, to say this is a plan. How can we fund the plan that we have, making sure that our people, the patients that are sick are not really affected by this. I mean, we're talking about the backlog. In hospitals like Baragwana Hospital, I think they're talking about surgery cases that have been put on hold, about 11,000 of those. The thinking is that load is, there's a possibility that they can do away with that load in 2026, December 2026. I mean, how do you expect those healthcare workers to be dealing with such a backlog? When, we had COVID-19 that has taken us back, not only on surgery, but also on HIV, treatment, on diabetes, on everything. So by this time around, you should be saying, let nothing else now compromise the delivery of health services. Let me make sure that load shedding does not disturb the plan to undo the backlog. But that's not what we're hearing from the minister.
It seems to me there's also, I suppose, more than just Treasury and more than just the Department of Health that needs to come in here, because the minister, of course, is concerned about the 77 of the 213 priority hospitals which are being supplied directly by Eskom. He doesn't even begin to speak of those which are being supplied directly by municipalities and how many of those are being exempt. And by the looks of things, none of them are actually being exempt.
That's correct. Like I said initially, we've got institutions that are in the rural areas. You remember at some point they never wanted to include some of the hospitals in the Northern Cape and other areas. Excluding them from this because they prioritize some because of the numbers that are attending those hospitals. But at the end of the day, all the hospitals, you don't imagine that there can be a hospital that is without electricity. Let me tell you, it's horrifying to see a patient who is being done a procedure when there is no electricity. A simple circumcision, when the electricity is out, that patient will be horrified because it is thinking, how are they going to stop the bleed? So all these things are important. They are impacting negatively on the psychology of the patients in the hospital.
Sure. What do you think then should be happening here? Because I think, as I said, the cooperative governance and traditional affairs minister would also need to be engaged here to facilitate the municipalities fast-tracking their efforts in implementing these exemptions to those healthcare facilities, especially in rural areas which are directly getting their feed from the municipalities. What do you think should be the intervention? I know you're saying you're calling for the minister to intervene here, but what are you suggesting could possibly be the intervention to mitigate against this?
Well, it's clear. This is a multi-stakeholder intervention. It can be, like you said earlier on, it can be just the Department of Health. It has to be all these departments, including the municipalities, that are going to come together and say, these are the hospitals, how do we intervene in terms of making sure that they are not affected? If they are affected, or how do we make sure that they have enough diesel? Treasury will come in. But also, we have to make sure that, there is a plan. The minister and the police, the administrators there, they need to come up with a plan. They are employed to do that. They are employed to make sure that there's always alternatives when there's a problem. You can't have people who are in that kind of office just throwing their hands in the air, without putting a plan in place, without engaging the stakeholders, without putting together all those that are affected or should be coming, together to give, South Africans what they need to have. I mean, it's disappointing. We have nothing to show at the moment.
Dr. Mzukwa, I appreciate your time as always. Thanks so much for coming on, and certainly one that needs to be engaged a little bit further, especially with the various departments. That is Dr. Mvuyisi Mzukwa, SA Medical Association chairperson. Doctors calling for the intervention of the Minister of Health and other departments, especially in prioritizing and with urgency the backlog of clinics and hospitals in the country that have not been exempt from the load shedding and the devastation that brings to the health system.